So non-elastic compression garments are not that known, it seems, in the medical world, but it is a great invention, and we use it quite a bit with our patients. And that also has a big range. Now, of course, the price goes up the more advanced you get. And I'm going to show you some examples just to get you familiar with what non-elastic compression is. We start with a pretty basic thing. I have a Juxta wrap and a Circade Juxta light here on the table. It is basically a legging, and I have another video that shows more in detail how to use this. But rather than sliding it onto your leg, you wrap it around your leg, and you have these Velcro straps that you tighten around your leg. So it's adjustable in size. It's pretty rigid. It will not allow your leg to swell, hopefully, depending on how much rigidity you need. First you put on an inner sleeve, and you put on a legging piece, and then usually it's enough to just have a compression anklet. So you just need a little sock with compression just for your foot and your ankle. If that is not enough, they do come with foot pieces with the Velcro. It's kind of like a neoprene, same material as the legging, but of course that makes it a little thick, and it makes it hard to wear a shoe. So for most people, they can just wear the elastic on the foot compression anklet with a non-elastic legging. And the beauty of this is you can actually reduce swelling with this. One thing I forgot to point out when I was talking about elastic compression garment is it is whatever size it is when you get it, and it doesn't change. And if you have swelling, you know that your leg can change in size from day to day, from beginning to the end of the day. So the key in measuring for or getting fitted for elastic compression garment is that you often need therapy first. You have to bring the swelling down and then put the compression garment on. It's a misconception that to use elastic compression socks to reduce swelling, because if you do, you're going to change the size of your limb, and then you'll need a new compression sock. But these non-elastic ones are adjustable, so you can use them to actually reduce swelling if it's not a real significant amount. So Juxta wrap has one version that's pretty rigid. Medi Circade makes one that's called a Juxta Light. It is not as rigid as the Juxta wrap, a little bit thinner, a little bit lighter. It can work for the milder forms of like venous insufficiency swelling. They do have a function on theirs that is pretty nice, because having good even pressure on these straps is important. So how tight do you pull these straps? And they actually have a little function, and there's two lines right here. The more you pull them, the further apart those lines separate, and then they have a little measuring tool where you're supposed to try to get those lines to a specific distance. So you can be more accurate in your compression because of that function. The Medi version has a closed-toe compression anklet, which we do like. But like I said, the Juxta wrap is a little stiffer, so if you need something a little bit stronger in close to the same pricing range, the Juxta wrap is a little thicker. But theirs comes with an open-toe compression anklet, and often our patients prefer closed-toe, but you can buy these from Medi separately. I think they're about $16, so that's an option too. If that is not enough, if you wear those and the swelling still tries to push out and it's just not working enough, you may have more severe lymphedema, then you can go up in thickness, like I said, and in price, of course. So the Juxta Light also has one that's called Juxta Fit. It has more straps. So this one only has 4 straps. The Juxta Fit has several straps going down. Each strap is a little thicker, so you get more compression. It looks more like this one. I don't have a Juxta Fit here, but this is also a Circade product called the Reduction Kit, which we also really like. And this also comes for the thigh and the knee and the foot and everything. And these are very customizable. So we can fit all kinds of shapes and sizes with this because you actually, you get the kit and then you cut it into the size that you want it to be. This material you can cut and it doesn't frail. So this is called the reduction kit, and that's a good alternative too. Although you may need to have a therapist help you, or an orthotic fitter help you size it out for you. But this can really work to reduce swelling even in a thigh. We have used it for some pretty severe lymphedema in the thigh where they were not able to come in for therapy. Maybe they lived an hour drive away from the clinic, and we had to find some other way that they could try to manage it, and we've used it and had success and had reduction with this. But like I said, you may need a therapist to touch base with every now and then to make sure you get it fitted right and get it cut to size.
Okay, and lastly, I want to talk about night garments versus day garments and show you one more, which I would say is probably the top of the line as far as trying to manage lymphedema on your own. So in the beginning, I talked about what's the purpose of the garment. Most people only need compression in the daytime because we're exposed to gravity when our feet are down. At nighttime, we're usually in a bed, so we're horizontal, and gravity is just not affecting our feet and legs as much. But there are some more severe cases of lymphedema where it swells even during the night, and we need compression garments. Often after surgery where maybe lymph nodes have been removed, so there's an obstruction in the lymphatic system, which means it can swell at any time if we don't have compression. So elastic compression garments, your regular compression socks, are not good to wear during the night when you're sleeping. They're more designed to be used when you're moving around and you have some movement in there. They can begin to hurt the skin and cut in. So at nighttime, non-elastic compression, like some of the ones I showed, can be used at nighttime, but often you also want to add a little bit of cushion or padding. Much like you want a mattress and a pillow when you're sleeping, you probably also want some padding for your compression. So this is an example of that. There are many different brands. Circade makes some that are thick too, called the Graduate. But this is one that I would say is probably top of the line that I'm aware of. It's called the Reed Sleeve. It has a very thick, comfortable padding. It does make it bulky, but we usually don't care if our pillow is too bulky. So we're looking for comfort and padding when we're sleeping. And then it's easy to put on. You slide it on, and then you buckle with these Velcro straps, go through these D-rings, these loops, and you just tighten it up. And they do also have a system for setting it to a certain pressure so that you can always get a constant pressure. Another line of compression for nighttime use that doesn't have the Velcro where you add that added pressure, but these are called chip sleeves, or they have different names, but it's basically little pieces of foam that have been sewn into a fabric. This particular one is a glove for hand, so it's very soft, very comfortable, easy to slide on. It provides a little pressure, and it also kind of micro massages the limb when you're sleeping. These come in all kinds of shapes and forms for any part of your body. So you have knee-high versions that would look kind of like this one. You have thigh-high versions, and that can be a comfortable way to keep some compression on while you're sleeping without it really squeezing too much. So thank you for watching. As always, it's best to get professional help in these decisions, but I hope there was some useful information in here to help guide you in the right direction. If you have a lymphedema therapist in your area, that's always a good one to contact. There's more information on our website, selfcaretherapy.com, and on our YouTube channel. There are more videos, and there'll be more videos coming relating to different products that can help manage swelling.